Bismillahirrahmanirrahim. Rabbi zidni ilma. Never let your fear decide your future. Assalamu alaikum everyone. My name is Dr. Sadia Rafiq and under the supervision of Professor Dr. Sarah Afzal. Today my topic of discussion is breastfeeding, baby-friendly hospital initiative and kangaroo mother care. Learning outlines include the topics of breastfeeding, its techniques and advantages, then baby-friendly hospital initiative, kangaroo mother care, recent updates and multiple choice questions. Learning objectives. By the end of this presentation, participants would be able to describe breastfeeding, baby-friendly hospital initiative, and kangaroo mother care and its benefits. Starting with breastfeeding. Breastfeeding is the feeding of an infant or young child with breast milk directly from female breast, for example, via lactation. It is a normal way of providing young infants with the nutrition they need for healthy growth and development. Milk production and secretions involve two reflexes mediated by two different hormones which come into play during lactation. First is prolactin reflex. Prolactin is produced by the anterior pituitary gland, which is responsible for milk secretion by the mammary gland cells. When the baby sucks, the nerve endings of the nipple carry messages to the anterior pituitary, which in turn releases prolactin. So if you see, when the baby sucks, the sensory impulse from the nerves go, then the prolactin in the blood releases. So more prolactin is secreted at night and it suppresses ovulation. So it's secreted after feed to produce next feed. Second reflex is oxytocin. Oxytocin is a hormone produced by the posterior pituitary. It is responsible for contraction of the myoepithelium around the gland, leading to ejection of milk from the gland into lacteal sinuses and lacteal ducts. This hormone is produced in response to stimulation to the nerve endings in the nipple by sucking, as well as by the thought, sight, or sound of the baby. So when the baby sucks, the sensory nerve impulse goes, oxytocin releases, and also makes the uterus to contract. So it works before or during the feed to make the milk flow. As far as reflexes in the babies are concerned, the baby's reflexes, most important one are bootling effect, which when something touches a baby's lip or cheek, the baby turns to find the stimulus and open his or her mouth, putting his or her own tongue down and forward, present about the 32 weeks of pregnancy. Second reflex is sucking reflex. When something touches a baby's palate, he or she starts to suck. Swallowing reflex. When the baby mouth fills with milk, he or she swallows. Preterm infants can gasp a nipple from about 28 weeks of gestational age. They can suck and remove some milk for about 31 weeks. Coordination of sucking, swallowing, and breathing appears between 32 to 35 weeks of pregnancy. And majority of infants can breastfeed fully at the gestational age of 36 weeks. Types of breast milk includes colostrum, transitional milk, mature milk, preterm milk, fore milk, and hind milk. Talking about the colostrum, it is released from 1 to 3 days after delivery. It is small in amount, about 40 to 50 ml on the first day, rich in white cells and antibodies, especially IgA, and it contains the largest percentage of proteins, minerals, and fat-soluble vitamins, which are A, E, and K, and then later milk. It is yellowish color, provides important immune protection. It helps as a laxative because it helps to pass meconium and prevents jaundice. Milk starts to produce in larger amounts between second and fourth day after delivery, making the breast feel full. The milk is then said to have come in. On the third day, an infant is normally taking about 300 to 400 ml per 24 hours. On the fifth day, it is 500 to 800 ml. Transitional milk is produced on 7 to 14 days. Some differences between mature milk and preterm milk. In a mature milk, it follows transitional milk, more thinner and watery, contains all essential nutrients for growth of a baby. And the preterm milk is breast milk of a mother who delivers prematurely. It has high quantity proteins, sodium, iron, and immunoglobulins. Some differences between fore milk and high milk. Fore milk is secreted at the start of feed, which is watery, rich in proteins, sugar, vitamins, minerals, and water. It satisfies the baby's thirst. The second is hind milk. It comes later towards the end of a feed. It is rich in fat content, provides more energy, satisfies baby's hunger, more optimal growth baby needs, both fore and hind milk. Baby Be allowed to empty one breast fully first. Baby receives only 4 milk, cry excessively. This is a few comparison between breast milk and cow milk. You can see the water content is almost same, the calories are same, the protein content is 1 to 1.5%, human milk it is 3.3% in cow milk. Then the carbohydrate content is more, fat is high in long chain fatty acids, minerals, iron is better absorbed, vitamins it is diet dependent basically, it is low in calcium, where potassium where it is low in calcium and D. It is digested early and it's same, and it is renal solute load is low. So it aids in renal function, whereas cow milk it is high. There are breastfeeding techniques. One is good lash on, and second is poor lash on. In good lash on, the baby's lips are turned outwards, mouth wide open, and chin touching the breast. Whereas poor lash on means lips turn inwards, mouth around nipples, and chin not touching breast. Some of the breastfeeding benefits: physical and emotional connection between mother and baby, contains natural nutrients, reduce risk of breast cancer, help lose weight after childbirth, contains natural antibodies, increases baby's intelligence, and easily digestible. Some other benefits of breastfeeding is naturally suits your baby, has the right amount of nutrients for baby's development, helps baby build a strong immune system, and lowers your risk for postpartum depression. Rules of breastfeeding. Exclusive breastfeeding for about 6 months and to continue for at least a second year. Complementary foods rich in iron and other micronutrients should be introduced at least about 6 months of age. Mother and infant should sleep in proximity to each other to facilitate breastfeeding. Initiation of breastfeeding should be encouraged as soon as possible after the birth, ideally within 1 hour. Ensure 8 to 10 feedings every 24 hours till to 3 months, then 6 feedings till 6 months, then 5 feedings till 1 year. At every feeding, the infant is placed on the one breast and then during the next feeding on the next one, thus alternating them. The duration of feeding is about 20 to 30 minutes. However, it is said that there is no exact time of every feeding of the infant. Every infant sucks the breast with different frequency and different duration of feeding. All breastfeeding newborn infants should be seen by a pediatrician at 3rd to 5th day of age. He will evaluate hydration level, evaluate body weight, assess feeding, and consider more frequent follow-up, discuss maternal infant issues, and observe feeding. All breastfed infants should receive 400 international units of oral vitamin D drops daily, beginning during the first 2 months of life. Do not forget for the administration of intramuscular vitamin K until after the first feeding is completed, but within 6 hours of birth. Barriers to effective breastfeeding are the lack of confidence in mother, belief that breast milk is not sufficient, lack of adequate support system, history of previous breast surgeries, breast engorgement, cracked and sore nips, embarrassment by mothers, and chronic illness in mothers, psychosis, or cancer. Contraindications to breastfeeding: HIV infection, active tuberculosis, herpes lesions of mother's breast, infant with inborn error of metabolism, phenylketonuria should not be breastfed. Mothers on certain medications like anti-cancer therapy, radioactive isotopes, feeding is withheld the period the mother is on the drug. She can express and discard the feed. After cessation of the medication, she can continue with the breastfeeding. Issues in breastfeeding are inverted or flat nipples, sore nipples, breast engorgement, breast abscess, not enough milk. These are the different breastfeeding positions. You can say it is a cradle position, cross cradle position, football hold, laid back position, and sideline. So these are the different positions to feed the child in the comfortable position of the mother and the baby as well. Remember that every single feed of breast milk is valuable. Your breastfed baby now has less distant interaction to last into childhood. Consequences of ineffective suckling. When a baby suckles ineffectively, transfer of milk from mother to baby is insufficient. As a result, poor weight gain, blocked duct or mastitis, the baby may pull away from the breast out of frustration and refuse to feed. The baby may be very hungry and continue sucking for a long time or feed or very often. The breast may be overstimulated by too much sucking, resulting in oversupply of milk. And some of the causes of poor attachment include the use of feeding bottles, functional difficulties such as flat and inverted nipples, a very small or weak infant, or inexperience of the mother. Preparation for successful breastfeeding. Motivate mother before birth. Select right place for the delivery. Avoid unnecessary use of drugs prior to delivery. Initiate breastfeeding soon after delivery. Give colostrum and avoid pre-lacteal feeds. Help baby suckle in a good position. Recommend demand feeding. Continue each feed as long as the baby wants. Do not wash nipple before and after every feed. Caution mother in advice about engorgement. Advantages of the breastfeeding. It's a complete nutrition, contains more suitable proteins and fat, rich in essential fatty acids, more lactose than other milk, offers enough vitamins, iron, and water, and is a correct proportion of salt, calcium, and phosphate. And the lipids help in proper digestion of fat. Second is it covers against infections, like it has anti-infective infective factors which include immunoglobulins, lactoferrin, lysozymes, cells, T and B lymphocytes, and antiviral factors. Storage of breast milk. Human milk can be stored at room temperature for 6 to 8 hours. Express milk can be stored in an insulated cooler bag with ice pack for 24 hours. Breast milk can be stored in the refrigerator for 5 days at 40 degrees Fahrenheit, and a freezer compartment of fridge for up to 2 weeks at 0 to 5 Fahrenheit, and it can be stored in deep freezer for about 3 to 12 months. So you can see this the whole about the breastfeeding. It has different position. It is a good attachment and a poor attachment. Then the differences between good latch and poor latch, and the burping position after the every feed to the baby. So you can see it's a breastfed baby, better brain development, better vision, healthier hearts, less tummy troubles, fewer food allergies, significant reduction in risk of SIDs, fewer skin allergies, less eczema, fewer ear and respiratory infections. So breast milk is medicine for babies born early. It contains special ingredients not available in formula. Moving towards our next topic of today's session, which is baby-friendly hospital initiative. It was started by UNICEF and WHO. You can see in 1991, WHO and UNICEF on the promotion, protection, support of breastfeeding aims to provide health facilities with a framework for addressing practices which have a negative impact on breastfeeding. To achieve BFHI accreditation, health facilities must demonstrate a rate of at least 75% exclusive breastfeeding among mothers at discharge. Adhere to the International Code of Marketing Breast Milk Substitutes. Successful implementation of the 10 steps to successful breastfeeding. Now we will discuss these 10 steps to successful breastfeeding, which includes first the hospital policies. We support mothers to breastfeed by not promoting infant formula bottles or teats, making breastfeeding care standard practices, keep track of support for breastfeeding. The second is staff competency. Hospitals support mother to breastfeeding by training staff at supporting mothers to breastfeed, assessing health workers' knowledge and skills. Third is antenatal care, reducing the importance of breastfeeding to mother and discussing the importance of breastfeeding for mothers and babies, prepare women to how to feed their baby, and care right after birth, encouraging skin-to-skin contact between the mother and the baby soon after birth, helping mothers to put their baby to the breast right away. Support mothers with breastfeeding, checking positions, attachment, and sucking, give practical breastfeeding support, and helping mothers with common breastfeeding problems. Supplementing gives only breast milk unless there are medical reasons. Prioritizing donor milk mother when a supplement is needed, helping mothers who want formula feed to do safely. Then rooming in, letting mothers and babies stay together day and night, making sure the mother of sick babies can stay near their babies. Then the responsive feeding, helping mothers know when their baby is hungry, not limiting breastfeeding times. Bottle teach and pacifiers, counsel mothers on the use and risk of feeding bottles, teach and pacifier, and discharge, referring mothers to community resources for breastfeeding support, and working with communities to improve breastfeeding support services. Since BFHI began, more than 152 countries around the world have implemented the initiative. BFHI promotes a multi-level, multi-sectoral approach, which together with legislation regarding statutory maternity leave and protection of the breastfeeding rights of the women in workplace. Enhancement of the code of marketing of breast milk substitute is essential to effectively promote, protect, and support breastfeeding. Monitoring and reassessment of BFHI facilities are important as the initiative expands. So the benefits of BFHI are increasing breastfeeding initiation, exclusive breastfeeding duration in many countries, improving mothers' healthcare experiences, and reducing rates of infants' abandonments. So the re-evaluation of baby-friendly hospital initiative in 2015, WHO and UNICEF began a process to re-evaluate the program. In 2017, the WHO guidelines protecting, promoting, and supporting breastfeeding facilities, providing mother and newborn services were published in 2017 based on the careful examination of fitness of each of the 10 steps. And in 2018, an updated implementation guidance for countries implementing the BFHI was published. So the next topic is kangaroo mother care. Kangaroo Mother Care Day is being celebrated on 15th of the May. Kangaroo Mother Care brings the greatest benefits for low birth weight of preterm babies when started as soon as baby is born. Why is it called Kangaroo Mother Care? A newborn baby kangaroo joey is very immature at birth and very small in size. A mother kangaroo's pouch provides warmth, safety, and constant supply of milk for joey. Similar to kangaroo's care, giving the human infant is also immature, and especially the low birth infants benefit from skin to skin care because it provides warmth, safety, and food. Kangaroo care is a method of holding your baby to your chest. This allows for skin to skin contact between you and baby. During each session, your baby will be placed naked except for a diaper and a hand on your chest, allow skin to skin for up to a few hours. A blanket, shirt, hospital gown, or robe can be wrapped around you and your baby bag for warmth. This wrapping of your infant into your chest looks like a mother's kangaroo holding her baby in her pouch, which is where the name kangaroo care comes from. Conventional neonatal care of low birth infant is expensive and needs both highly skilled personal and permanent logistic support. Evidence suggests that kangaroo mother care is a safe and effective alternative to conventional neonatal care, especially in under-resourced settings, and may reduce morbidity and mortality in low birth infants as well as increasing breastfeeding. So the kangaroo mother care involves early, continuous, and prolonged skin-to-skin care contact between a mother and her newborn, frequent and exclusive breastfeeding, and early discharge from hospitals. Some of the benefits of kangaroo care for babies are assist babies with temperature regulation, improves brain functioning, helps babies sleep better, makes their heart rate more stable, help them gain more weight and faster, encourage breastfeeding, reduce stress in baby and mom, gives dad a chance to bond with baby too. So among infant born early or small, kangaroo mother care has been shown to reduce infant deaths by up to 40%, hypothermia by more than 70%, severe infection by 65%. It is a document by WHO. So why kangaroo care? Fewer baby deaths, fewer babies with severe infection, fewer babies becoming cold, better success with breastfeeding, early baby mother hospital discharge, better parent-baby bonding. So summarizing all the benefits of kangaroo care to babies, stabilizing your baby's heart rate, improving your baby's breathing pattern, making the breathing more regular, improving oxygen saturation level, gaining in sleep time, experiencing more rapid weight gain, crying decreases, having more successful breastfeeding episode, and having an earlier hospital discharge. Moving towards the recent updates. It is about the breastfeeding document of World Health Organization in Pakistan. So breastfeeding gives babies the best possible start in life, and breastfeeding works like a baby's first vaccine. So new analysis shows an investment of $4.70 per newborn can generate $300 billion in economic gain by 2025. So in Pakistan, promotional breastfeeding could save the life of 8 million plus children under the age of 5 globally by achieving enhancing rates of breastfed children. It was relieved in a newly released joint WHO UNICEF report. The report stated that no country in the world fully meet the recommended breastfeeding standard and that only 23 countries out of 194 nations have exclusively breastfeeding rates above 16%. So the kangaroo mother care helping preterm baby survive, ensuring the survival of preterm baby with the revolutionary kangaroo mother care technique. It's also been implemented, and in the lower middle income countries, it's also playing a very vital role in the decreasing the morbidity and mortality of newborns. Then this was an article, Kangaroo Mother Care Opportunities and Implications for Rural Pakistan. The abstract was this: the neonatal mortality comprises 40% of total under 5 mortality globally. Kangaroo mother care is one of the most effective interventions to reduce neonatal mortality. KMC does not require high equipment, expensive care facilities, or technical knowledge. It was a meta-analysis reporting that KMC may reduce neonatal mortality in low birth weight by 36%. So, second is the implementation of baby-friendly initiative in various private and public hospitals of the Lahore. The aim of this was to implement the BFHI in the hospitals, and the result showed it was around 60.8% of BFHI guidelines are being observed and implemented in various hospitals in Lahore. The same introduced kangaroo care for first time in Pakistan. It was the document on their website. Now it's time for multiple choice questions. A mother has a sufficient breast milk supply. She wants to give her child 1 to 2 cups of animal milk per day over and above the breast milk she is giving to, and also other food options. Appropriate time to do so will be after the baby is 4 months of age, 6 months of age, 8 months of age, 1 year of age, or 2 years of age.
B.
Yes, B is the correct option, 6 months of age. Hypoglycemia, both systematic and asymptomatic, is a common concern in healthy term breastfeeding units. While glucose monitoring should be performed only in high-risk infants and those who are symptomatic, the management strategies employed to prevent and treat hypoglycemia should support breastfeeding. Which one of the following strategies is the best method to prevent symptomatic hypoglycemia? A. Glucose monitoring every 30 minutes following delivery. B. Oral glucose solution by mouth immediately after birth followed by breastfeeding on demand. C. Early initiation of breastfeeding on demand within 30 to 60 minutes after delivery. Define hypoglycemia less than 45 milligrams per dl within the first 3 hours after delivery, or glucose monitoring for first week of birth.
C.
Yes, C is the correct option. WHO and UNICEF recommend that children should initiate breastfeeding within the first hour and be exclusively breastfed for the first 6 months. All of the following are recommended to encourage successful breastfeeding, except initiation of breastfeeding within 1 hour of birth, avoiding the use of pacifier and artificial nipples in teen breastfeeding infants, continuous roaming in with breastfeeding on demand, restricting length of breastfeeding time to prevent nipple soreness and engorgement, avoid use of supplemental formula during the early stages of milk production.
E.
Yes, D is the correct option. LASH is a structure assessment of breastfeeding. Systematic use of LASH can help identify which mother and babies need additional support or referral. Which of the following is a correct statement about the LASH during breastfeeding? The baby must take all the areola in the mouth to achieve a good lash. A narrow angle of the corner of the infant's mouth is indicative for good lash. The baby needs to be lashed so that compress the milk sinuses when sucking the breast. The baby needs to be lashed so that it presses the base of the nipple when feeding. Mothers who have had previous breastfeeding experience rarely require assessment of the baby lash in the hospital or birthing center. Which is the correct statement?
A.
No, C. The baby needs to be lashed so that compresses the milk sinuses when sucking at the breast. Letdown reflex or milk ejection reflex make the milk that is already in the breast flows from the current feed and helps baby to get the milk easily. The hormone primarily responsible for milk ejection or letdown is estrogen, progesterone, prolactin, oxytocin, or transferrin.
D.
Yes.
Oxytocin.
Oxytocin, yes. Colostrum is a nutrient-rich first milk produced by breast during pregnancy. It changes to transitional milk after 2 days. Compared with chloremic, colostrum is lower in sodium potassium chloride, high in fat and sodium, high in protein, sodium and fat soluble vitamins, lower in fat and carotenoids, and higher in water soluble vitamins.
C.
Yes, C is the correct option. When discussing feeding options with parents of healthy full-term infant in your practice, which one of the following do you usually recommend for the first month of life? Formula feeding exclusively, breastfeeding exclusively, breastfeeding with formula supplement, make no recommendation or support mother's choice.
B.
Yes, B is the correct option. A mother with a 3 days old baby present with sore nipple. The problem began the first feeding and has persisted with every feeding. The most likely source of this problem is baby's suck is too strong, baby's time is too long, lack of nipple preparation during pregnancy, inverted nipples, or poor attachment to the breast.
E.
Yes, E is the correct option. Breast milk jaundice most often occurs in the first week of life when breastfeeding is being established. It is best characterized by weight loss, poor feeding, brick, dust urine, a high direct bilirubin, a thrive infant with persistent jaundice. E is the correct option, a thriving infant with persistent jaundice. 10th, all staff of hospital should receive orientation of the breastfeeding policy and its implementation. Hospital policies that interfere with breastfeeding include all of the above except moving the infant to the nursery for the right to allow mother to rest and build up her milk supply, feeding schedule every 4 hours to allow mother's breast to make more milk, use of pacifiers to prevent the infant using mother as a pacifier and giving her sore nipples, showing all mothers how to extract or pump blood milk in case they are separated from their infants, routine water supplementation by dropper to prevent dehydration.
C.
D, showing all mothers how to express or breast milk pump in case of separation. It is the exception. So this is the key. This is the YouTube link, and thank you so much.